Can your teeth be making you sick? Well, we all know that bacteria in our mouth causes cavities, but have you thought about root canals? And what about having your wisdom teeth taken out? Did you know that these are both breeding grounds for multiple bacteria? And I bet you didn't know that amalgam fillings that contain mercury and copper can both be breeding grounds for bacteria also. So bacteria and the toxins that they produce can cause disease.
It's a big problem, and it's not one that's widely accepted in mainstream dentistry. It was back in 1909 that Weston Price, a dentist at that time, studied this and did extensive studies on it. And he presented, or his family presented, Dr. Hal Huggins with this information back in 1986. And at the time, Dr. Huggins didn't know much about what was in those papers, but he was stunned when he saw how much research was done showing that these infections that are in the presence of root canals and cavitations, which are the places where wisdom teeth have been removed and what's left, are major issues in our health.
This is amazing to me that this has been ignored since 1909. They've known about this. And what's the Dental Association say now?
Not much, and a lot of it's recommended around arrogance and about being naive and thinking that they're just right because that's what's been accepted as what's going on. And it's also about money. You know, once the status quo is in place and it has a technology that it uses, it holds on for dear life because it doesn't want to disappear, because if it does, it's going to lose all the income that goes with it.
Well, this is where knowledge is power, and why it's really good that you're actually listening to this and that we've been learning about it also.
Right.
You know, inflammation is the main cause of disease, and cardiovascular disease is caused by inflammation.
Well,
and so having these situations in our mouth really are making us seriously ill.
There's a lot of information about periodontal disease and heart attacks and strokes.
Tell us about the story with the rabbits. And
Weston Price did some studies, and so did Hal Huggins, I think, and so did the Mayo Clinic back at that time too. Weston Price sacrificed about 60,000 rats or rabbits, and I guess Hal Huggins another 11,000, trying to reduplicate the work that he did back in 1909. And what they did is they took the tips of teeth that had root canals in them, they ground them up, and in those patients from which those teeth were taken that had a recent heart attack in the previous weeks, when they ground it up and they put it into rabbits, guess what? The rabbits got heart attacks. And they could even do that by filtering out the microbes that were in those sections or in those ground up teeth. And they could do that by using certain filters, and all that would be left would be the toxins that would be dissolved in the fluid that was present. And that too caused heart attacks. So now we've got good data on thousands and thousands of rabbits that shows us that this is something that we should be paying attention to.
Well, also, didn't they show that streptococcus pneumonia could be caused from root canals also?
There were probably about 90, close to 90 different microbes that are found in cavitations or root canals. And those particular bacteria, interestingly enough, can produce up to 5 different kinds of endotoxin, which is what makes us sick. And that depends on what the environment is like, that determines which endotoxin or how many endotoxins are going to be secreted by those microbes and cause the problems with our health.
Well, this is really making the cause of disease a little more complex, because frequently we're talking about lifestyle and how important it is to, live a healthy lifestyle and get enough sleep and exercise.
Yeah, well, all those things matter.
And stress reduction and all that. But also with immunity, and also when people take antibiotics, it can cause problems too. And then we've got our genes. And so we're always talking about different things. And now this is something else to add to the pot of soup.
Well, we take a lot of these things just for granted. You know, I have some patients who have 5, 6, 7, 8, sometimes 10 root canals, and maybe had all 4 wisdom teeth taken out. So you know that there's a toxic soup in their mouth, and that may have a lot to do with whether or not they're sick. But what really matters is what Vicki just said. It's about what kind of condition is the host in, and how toxic is the soup that's in someone's mouth. And that determines whether or not you're going to get sick and how you will be sick.
So let's define what a root canal is and the accessory canals and the tubules so that people can really understand why this is
Fair
such a
enough.
problem.
Fair enough. A root canal is usually done when a tooth is in pain or where there's a clear infection, and very often in the root of the tooth. And very often, what the dentist will do is they'll X-ray your mouth, and if they see a dark place where there's resorption of bone, where the tooth is held in place by the bone, they'll say, well, there's an infection there, and we need to do a root canal. Now, if there's a lot of pain there, no question. And sometimes they're absolutely right that when there's this dark space there is infection even if you don't have symptoms. But that's something that is leading to doing these root canals so they can get rid of the infection, so they think. So they go down and drill a hole in the tooth right down to the root, take out the nerve, so now the tooth is dead, and think that they put a little gutta percha in there, which is the kind of wax that they use to seal off, so they think no infection from the inside of the tooth can be a problem, keeping in mind that there are miles of tubules in the dentin of the tooth that are impossible to sterilize with something like gutta percha. So what we have is a situation here where a lot of microbes are breeding grounds inside those miles of tubules, and they continue to express themselves, increasing their volume, and they ooze out into the surrounding tissues. And that's why when a tooth is removed that's had a root canal, you can see a little pocket of pus at the tip of it. There's a lot of infection, and in someone who's not got good health, that can be a major factor.
Well, there's something like 92 different types of microbes in a root canal, and they exude 460 toxins.
There's a lot of toxins that they can come up, a potential of 460 toxins, because each of those microbes can make about 5 different kinds of toxins.
And then there's this, like you said, this necrotic tissue in the root canal
that they feed off of.
And the dentists tend to say that they can sterilize that, but according to this article, they really can't do that because, like you said, there's miles and miles and miles of tubules and accessory channels.
What Weston Price found and Hal Huggins found was that when they ground up those root canals, that every one of them was infected. And the tip of every root canal that was there had some infection at the tip as well. So the tooth is infected, the tip has got a little pocket of pus, and that is what's causing some of the things that we're seeing in medicine today.
Okay, so one of the other causes of infection are cavitations. So let's talk about what a cavitation is, because that has to do with having your teeth pulled.
Right. So when you take out your wisdom teeth in particular, what happens is it leaves a space where the tooth was that's called a cavitation. And apparently, these don't heal. And so what you wind up with is low-grade inflammation in that cavitation that can, like we said earlier, can have as many as 82 different kinds of microbes in it that continue to infect the area around where that tooth was pulled and can leach out into the mouth and into the bloodstream and cause health problems.
If you've ever had a tooth pulled, they tend to tell you to bite on the gauze to stop the bleeding. And according to this Weston Price group, they said that it was better to allow that tooth to bleed for about 5 minutes to get the toxins out.
Exactly. I think it's a good idea.
Yeah. Well, also, there's another topic that we need to touch on here, and that's amalgams that are composed of mercury along with copper, because those are very toxic and cause a lot of...
Well, that's a special problem. If you just look at mercury by itself, that makes up more than half of an amalgam. Most people don't realize that mercury is at least half of the amalgam. And the Environmental Protection Agency will allow you to put mercury only in a toxic waste dump or your mouth. That makes a lot of sense. And then we wonder why people who have a lot of amalgams and have a deposition of mercury in their body and even in their brain are not able to resist disease as well, because immunity is suppressed as well. We know that natural killer cells are suppressed by heavy metals like mercury.
And then when you add copper to the mix, it even makes it stronger. In fact, they were saying that you shouldn't even have a quadrillionth of a piece of copper in there.
Well, the problem with that is it stimulates the microbes to make toxins.
But it also causes a negative electric charge, and it fries the pulp.
Yeah, so it's a big problem. So the copper also causes the mercury to come out and vaporize more, and so you inhale it and it poisons you. That's how you get poisoned by the mercury. And it also causes the copper to come out in larger amounts, which is not a good idea. So we've got a problem here that is underappreciated, and we need to do something about it to change what we do to our teeth. I mean, it's nice to have amalgams that will last for a long time, but it's not a good idea if we're getting poisoned by it, and it's not a good idea if we're doing root canals or cavitations, because they too are causing problems with infection.
So we need to give you choices here. Composites are a good filler for cavities.
Of course, better yet, make sure that your teeth are healthy. And that doesn't mean use a lot of fluoride, which is another topic that you can look on drsabuto.com, because fluoride poisoning is far more common than the protective effect you might get from having a lot of fluoride in your diet. So this whole topic needs to be brought to our attention. We need to hold our dentists to the new standards that have been raised in the last 100 years so that we can not poison ourselves and not be subject to the illnesses that we see because of infection stemming from our mouth.